Hello, everyone. We'll just wait a few moments for people to log on so everyone can join in. And this webinar tonight is for young adult members and their carers to support a smoother transition into the adult healthcare system, to really support independence for self-management and also self-advocacy. So we'll just wait a few moments. So we might make a start this evening. So welcome everyone to this webinar titled Young Adult Members Transitioning into Adult Care. I'm Estella. Thank you for joining me this evening, and thank you to our presenters who are with us. Before we begin, I'd like to acknowledge the traditional custodians of these lands. I would firstly acknowledge the Darwal peoples where I am, the traditional custodians where we gather here today, and the traditional custodians, of course, of the lands where you are, and pay my respects to all elders, past, present, and also those that are emerging in our communities. I also extend that respect to any Aboriginal and Torres Strait Islander people who gather with us today through this webinar. So just to let everyone know that we'll be recording this webinar and sharing the recording on the IDFA page. So hello everyone and welcome to the Immunodeficiencies Foundation Australia PI Education Program. We look forward to bringing you, I guess, valuable topical informational education webinars each month. The Immunodeficiencies Foundation Australia, for those that don't know, is a member-based organisation that represents people living with primary and secondary immunodeficiencies. We're a national peak body with more than 2,000 members. Our vision is a future where primary and secondary immunodeficiencies are diagnosed and treated early, with the affected people supported by clinicians, community and government to allow optimal quality of life. And as Australia's peak patient organisation, our strategic priorities are education, awareness and advocacy. So we do hope that you enjoy tonight's session and find it valuable. So for tonight's webinar, we'll feature two main presentations followed by some useful support resources for you as young adults. Firstly, Dr. Alyssa Kane will share what you can expect when you transition out of the paediatric system and into the adult healthcare system, and some common issues you may face, and from a doctor's perspective, how you can best prepare for the transition and manage key changes to your care. Secondly, we have young adult member Zoe, who can share her transition journey and the areas that she struggled with and how she managed the changes to her care team and her treatment journey. And of course, lastly, I'll highlight some digital and other resources that you may find useful as young people to support your well-being during the transition journey, and indeed, I guess, throughout your journey as a young person living with a primary immunodeficiency. So our first speaker, we're very pleased to have with us Dr. Alyssa Kane, a New South Wales immunologist, sharing her insights supporting young adults with primary immune deficiencies. She'll be providing her perspective, I guess, as a doctor, and she's worked at Liverpool Hospital and St Vincent's Hospital in Sydney, working with adults and young people moving into the adult healthcare system. And she's led very significant immunology research projects with the Garvan Institute. And she's also a participant on our IDFA Health Professionals Advisory Panel, assisting with member inquiries, webinars, and IDFA projects. So over to you, Alyssa.
Thank you, Estella, for that very kind introduction, and thank you everyone for attending to come and listen to our presentation today about transitioning from paediatric care. Look, I think this has become quite a hot topic, and it's an area, I guess, even as health professionals, we're probably still learning and trying to innovate on. So, I'd like to learn as much from you guys as much as I'm imparting some of my perspectives today. So just move on to our first slide, please, Estella. So, when as health professionals we mention the word transition, it essentially refers to a purposeful and planned movement of children or adolescents and young adults with chronic physical and medical conditions from a child-centered to an adult-oriented health system. And so in reality, that means children who have been treated at the children's hospitals moving into adult care services, whether it's another adult hospital or private practices or to GPs. And there's no specific age where this transition occurs, but it's essentially something that occurs around from the age of 14 in sort of early to mid adolescence and can extend all the way up to people's mid 20s as people sort of gain more autonomy about their lives and their health care. Next slide, please. And really, the two main goals of that transition process is that that young person who is affected with an illness becomes independent managers of their own health, and that parents and carers who had originally and had been in that role of the decision maker for health, then move into that support person space and provide ongoing support and continuity for that young person. So I think considering both of those role changes is really important, and it's something that I guess healthcare professionals need to work together with both parties involved, or usually more than one party involved. Next, please. So as a young person, what do you need to do to start this process or to start thinking about this process and to complete the process? There's some key things. So firstly is being aware of your own medical history, what your diagnosis is, what treatments you've had, what's happened to you in the past and what's going on for you right now. It's starting to become aware of your own privacy rights. And so there is a separation that does happen from your caregivers. And so it's just thinking, and it's not complete, it's more just thinking about, well, what do you want to keep private to yourself? And what are you happy for other health professionals to know, or other family members to know? And it's probably something that you haven't thought about before, but as you reach independence, that's something that you want to be aware of, because people have differing perspectives on this, and you might want to come to an agreement with your parents and caregivers as to where the boundaries are. And then thirdly is to be aware of how the health system works and how to navigate that, which is not easy. It's not easy as adults either. But I think as a young person with chronic health issues, it's something to start thinking about. And that's really about who is looking after you and where. Okay, and so I think I've covered this, but essentially in terms of your medical history, it's about what is your diagnosis? Does it have a name or a label that you're aware of? What does it mean? How was it made? So how old were you when you had it? What symptoms did you have? Some of these things you'd be too young to know, so it's something that you might want to ask your parents about how that diagnosis was made. And having a bit of awareness of which doctors that you've been seeing, who are the specialists and what their role is, thinking about what medications you're on and starting to understand why you're on different types of medications and having a bit more awareness. And then maybe also starting to, I guess, think about, well, these treatment options have been made in the past, but there are maybe future options to start considering. And it may be due to lifestyle change or other factors moving away, or even changing health symptoms in terms of, what other options should you be considering? Because essentially, by legal definition, I suppose, when people are 18, we do have this expectation that the medical care is guided by the person who is an adult in consultation with all the caregivers, but we really like to make sure that people have informed consent about the treatments that they're having and their options. And so in immune deficiency, it's the most common one might be whether or not you want to stay on intravenous immunoglobulin replacement therapy or move over to subcutaneous immunoglobulin therapy, and that kind of thing. Okay, next please. So as a young person, what can you do to start preparing? I think it's important as you get older to start feeling more comfortable about talking to your health team yourself. So, when you're very young, usually the parents will speak to the doctors, but as you get older, hopefully the doctors are sort of preparing you for that transition and starting to talk to you directly, whether alone or together with a parent. And also start getting a bit of an idea from your current care team about what's going to happen when you leave. Who will you be seeing, which hospitals will you be going to? And you can start practicing that by starting to see your doctor and your other health professionals like the nurses, social workers, physios on your own. And one of the differences that you will notice in the adult world is that adult physicians are much more interested in interacting with the affected person than parents or caregivers, which is the complete opposite really of probably of what you experience in the pediatric system, where a lot of the questions might be directed towards the caregiver. So it's something to, I guess, think about and to be prepared for. Okay, next. Specifically what to think about with regards to immune deficient conditions is, as I said, a lot of the treatments can be complex. So do you know what treatment options have been discussed in the past or are available to you? You understand what your treatments are. Having a think about, maybe considering what your health might look like in the future, because a lot of what we do in healthcare is now preventative. So we want to prevent you from getting sick. So sometimes we will use treatments, not because it's treating something specific here and now, but it's to prevent you from getting unwell in the future. And so just kind of, I guess, having an understanding about, how treatments work and why. And immune deficiencies, increasingly with genetic diagnoses, children are receiving genetic diagnoses, but oftentimes the implication of that, while the parents understand, the affected person often doesn't have a good understanding of that. So if that's something that's affected you, it might be something to have a chat with your parents and your doctors about, and also getting some more advice on that as you get older. Okay. So then I thought I would describe a little bit about how the health system works. It is very complex, and I have to say there is state-to-state differences, but essentially we have our primary caregivers or primary care, which is by your general practitioners, and they essentially are seen as coordinators of care as well as the first point of call as well. So they'll typically see you when you become acutely unwell and help coordinate your specialist referrals and appointments and put all that information together. So as specialists, we would write to our GPs saying what the assessment was and what the outcomes were, whereas typically a general practitioner wouldn't write back to us in terms of your day-to-day health, but may communicate, if something major does happen, or send through referrals. And then, you'd be seeing your specialists who are organ specialists. Sorry, I've got a bit of a cold, so just drink some water. And so your specialist immunologist might be based in a hospital, or they might be based in a private clinic. And then there are other doctors that you might see similarly at the hospital or the private clinic. So typically I often would have patients that would see me, as well as a lung doctor, maybe a gastroenterologist or a kidney doctor as well. And then there are the the other health specialists, so the nurses who, maybe an immunology specialist nurse or non-specialized, as well as social workers, dietitians, depending on your care needs. There's quite a lot of people involved. Next, please, Estella. So public health care is set up according to health services, and the way they interact and the way you negotiate them can differ from state to state. I work in the New South Wales Health Service, so I can kind of explain my health service. So in New South Wales, depending on where you live, you've got a local area health service, and sometimes services are restricted to people who live in that area health service. And so that's something to be aware of as well. Whereas the paediatric hospital, there's only 2 of them in New South Wales. And so by and large, they work across these health services. One of my hospitals that I work at, St. Vincent's, also has a general sort of policy about being across a local health district. So we do see patients outside of our own local health service. I think ours is so small that it doesn't really count. So we see people from all and provide services to people from all around the state, and as well as some parts of Australia as well. But so depending on your setup, that can sort of restrict who you see in the public system. If you access the private system, then these boundaries don't apply. Okay, next, please. So I guess going step by step in terms of what you do to look after your own health, the first thing, I guess, is making an appointment. So one of the first tasks I think that, you can, as a parent, you might delegate to your child, or as a young person ask to do yourself, is to work out how to start making your own appointments and organising your own tests. And that sort of involves being, a little bit organised, planning your time, knowing, if you need to take time off school or work, how is that going to fit in? You might want to be aware of any costs involved in healthcare. A lot of things can be covered by Medicare, but of course, if you see someone privately, that might incur a cost. There's differences between public and private healthcare. So by and large, if you go to a public hospital, you don't get you're not guaranteed a choice of the doctor you're seeing. So if you go private, then you can have that degree of choice. And of course, with the large teaching hospitals, and you're probably used to this if you have navigated the pediatric system, is that we do work in teams and there are training doctors who may see you as well. In terms of knowing how to make your appointments, it's really just about knowing what number to ring, how to explain who you need to see and why, and when you need to see people. And it helps you to feel more relaxed and in control of the day. Make sure that clinic number's in the phone. Some comments that we get back from people are things like hospitals looking and feeling different, and having some control does help you to, I guess, manage those anxieties. And of course, before you get to the appointment, think about what you want to say or ask questions about, because you have a time slot with your doctor that might be anywhere from 15 minutes to half an hour, but depending on what issues you need to discuss, that might not be enough time, so you might want to prioritize the things you want to talk about. We'll often guide the discussion, but really we're dependent on people to come in to tell us what's been going on and where their health might not be going so well, so we can help solve those issues. Next, please. And so the first appointment in transition, I find are quite long appointments, and it's because usually the young persons come with quite a long medical history, and with the transition process, we essentially need to understand everything that's happened in the past, so then we can make plans for your care going forward. And so we will have to ask about your whole health story, which can take some time. And with immune deficiencies, we often start right from birth all the way up until what's been going on now. We get a comprehensive list of your medications, allergies, a family history. So who's in your family, what kind of illnesses do they have? Because some immune deficiencies, for example, can be inherited, but so can other health conditions. Or if it's not inherited, you may still have a strong family, predisposition to certain things like allergies or types of cancers or heart disease. So all these things we like to find out about. And we also take a social history as well. So we ask about, who you live with at home and what you do with your time. Are you studying? What your hobbies are? How are you managing your finances? If you're doing any drugs, alcohol, smoking or vaping as well, because this all really impacts on your health and also how you navigate health as well. And that helps us to understand who you are and to provide the most appropriate and tailored help for your health. So we ask patients to keep regular appointments, and that's essentially because we're very health focused. So we want people to stay well. We don't want to be reactive and to treat people as they get sick. We would rather see you earlier and monitor you through blood tests and minor symptoms and make adjustments to prevent you from having major health episodes. But of course, if you do get sick in between the regular appointments, we'd like to see you to manage these new conditions as you go. And there are certain things that happen in life to a young person that we also like to help with and discuss. And in particular, if you're young, reproductive health is a really big one, because as you get older and you enter your 20s and into your 30s, that's when people start having families. And so usually with if you're on lots of medications or have health issues, it's something that, you know, should be planned to improve and have the best sort of support available to you as you go through those life changes. So the stages of transition, you know, I say starts around 14, but can be early as 12. And it's really just to start developing those skills. So it's about developing self-management skills, about developing confidence to learn to start to talk to adults by yourself, and, you know, thinking of questions to ask. And you might start working a bit more closely with your GP to monitor your health. And it's all about developing confidence so that eventually you'll become an independent adult in terms of your health. Okay. And then in the mid stages of transition from 14 to 16, this is when you might want to start learning more about your condition, because you're getting to that age where, you know, 16, some patients do transition as young as 16. And so at that stage, you may get involvement, particularly from the children's hospitals. There are statewide transition services in New South Wales. They're called Trapeze, and somebody might help you organise all your appointments in terms of moving from the kids to the adult hospitals. You might want to have a chat with your parents and carers about becoming more independent and find out more about, you know, living with a chronic condition and getting to know yourself better. And those might be including, you know, ways to be healthy, and also looking after your mental health, looking after your stress and anxiety levels. You might want to think about, you know, how you're going to make these decisions. As I said, plan your appointments. And then there's practical things like even thinking about starting to apply for your own Medicare card and getting ready in that way. Next, please. And so between the age of 16 and 18 is usually when most people would transition into the health service. And that's because you're in an age where mentally you're capable of doing that. Usually we do take life stages into account. So, you know, are you going through exams or have major life changes and things like that in terms of the actual time frame. And again, at this stage, this is when you really should be starting to think about, well, what would it look like if you were an independent, you know, health decision maker for your own self. You might want to think about, I think, things like financial benefits as well. If you're leaving school and if you have significant health impairments or disabilities, that might be something that you need to consider. A lot of this advice is also from the Agency of Clinical Innovation that I've referenced there, and you have a really useful practical checklist for young people who are transitioning. Oh, there you go. Thanks, Estella. So yes, you can access that on their website. And I should mention that a lot of the information about becoming independent, of course, applies to people who can become independent. If you're a carer and you do have a child that is unable to make those decisions independently, then still a lot of those principles in terms of getting together all that health information from your current caregivers still applies, because that needs to go across. We do communicate between ourselves as well as health professionals, but it's often good, you know, to have that information yourself as well, to carry it with you, so you can pass that information on. So, sorry, can you just go back, Estella? So I just thought I would mention, you know, how do patients actually feel about transition? Because it's something that I guess is not well looked into, and it's really sort of new research that's helping us inform transition services, because I think overall as healthcare professionals, we realize that our transition services aren't great, and so we are trying to improve them. So this study was done by a colleague of mine, Ayano Kelly, who works in a sort of like an adjacent space in rheumatology, and she looked at a whole bunch of studies that had looked into this in terms of patient perspectives on transition. So I thought it was worth going through this in a little bit, because you might find some, commonalities in how you're feeling or you felt when you transitioned, or when your child transitioned. Next, please. So this was a really big study. They looked at over 2,000 studies, and they found that 26 of them had good enough data to include. And so it was 451 participants from 11 countries overall. And it was qualitative research. So it was looking at really how people experience that transition. And so they found that for people who were transitioning, some supportive aspects were being prepared for those sudden changes and kind of having a sense of belonging, in the new hospital or the new care space, and also having a sense that becoming autonomous for your decision making was something that you wanted to do. Some of the barriers that people experienced were a feeling of abandonment from your healthcare professionals in the pediatric space because you'd known them for such a long time, and also a great fear of the unknown. So a lot of the times patients are sent off to see new specialists, but you haven't been introduced and you don't know, how much they know about you or how they operate, and I guess sort of just not knowing how it's going to look. There are definitely less resources in adult care, so there's definitely a sense of feeling a bit more anonymous and dismissed in adult care, particularly I think if you've been in the pediatric system for a long time and you've gotten to know everybody really well, and then you get thrown into the new system with new people who might not know you as well. And the other factor was tensions in parental involvement, because there is that transition for the parents as well, where they need to kind of take a step back and you're stepping forward, and how that looks really can be really different for, every family. And some people, I guess, do it better than others. Next. And so in terms of things that can help nurture a successful transition, essentially it's things through having, good preparation. So having confidence, developing confidence through an actual introduction into the adult environment from your pediatric service, and having a security and having, a reliable source of contact, so that you know who you're going to contact if you're running into trouble in the adult service. And then minimizing any disruptions to your current lifestyle by moving across to the new system. Things that kind of make the transition less difficult is when the transition is abrupt and you weren't aware of it. It suddenly happens. You haven't had time to say goodbye. Some people felt quite shocked going into the adult service, just having, different types of people in the waiting room. And that feeling of vulnerability with, your loss of what you knew and your privacy. Next, please. Important was also having a sense of belonging, so having some familiarity with what's happening. And what IDFA do well is through peer support, so having some connectedness and shared experiences, and being reassured by others of a similar age or going through the same processes. And then things that, kind of goes, I guess, in the less supportive or barriers for this is that feeling of being dismissed in the adult system, particularly if you're going through things like pain and fatigue, and not having that acknowledged or not being able to express those because you're with new people. Okay, next please. And then the final point was about the quest for autonomy. And so as kids get older, sometimes they start to feel controlled and patronized in that pediatric system. So some of the patients who do come over are actually quite happy to come over because finally they feel like they can have a bit more control, and they're allowed to because that's the way we're set up. And they have a bit more freedom to talk about things that they might not want to talk about with their parents, particularly like sex and drugs and kids and having children or a genetic diagnosis. We often find differences when parents are there or not there. And then there's also, difficulties with that parental separation. So there might be a feeling of being overshadowed by that parent, but also guilt because, you've been managing your health collaboratively, and something that you might not want to let go of. And so there's a lot to unpack with those relationships there as well, which we try to be understanding of. Okay, next please. And so in terms of the types of support we'd like to give, we really advocate to our colleagues in pediatrics. I'm an adult physician, to really start that process of transition early, and to, allow that person and the family transitioning to have a gradual preparation and plenty of time to ask questions and get used to the processes. We don't really have a good system of a combined referral into the adult systems, at least in New South Wales. I know in Adelaide, because there's only one sort of hospital that does both, it's a lot smoother, but that's something that we're trying to develop, particularly in our state as well. We also try and make sure that people are informed about what they might experience when they come over to the adult system, just from basic things like what our adult waiting rooms look like and how they're arranged, and also make that process smoother by handing over patient information. And we also like to create opportunities for young people to communicate freely. So oftentimes, the first appointment, I might see the young person and their carers together, and then depending on how that goes at the end of that appointment, I might just speak to the young person themselves, or I might encourage for the next appointment that the young person does spend a little bit of time by themselves, just to get used to that idea. In terms of when is a good time to transfer, really the transfer should be happening when the patient and their family is ready. We try not to be too prescriptive about age, but certain things can, influence that process, in particular things like access to medications, or age barriers in terms of procedures and things. So, and then really what we recommend is good support during that transition process, which may be from peer support. And again, that's something, as I mentioned, IDFA is looking to help with their peer support programs, for patients supporting each other. And then might just go to the next slide, I think. Okay, this is my final slide. And so there's a lot of things that we need to do to transition patients across so that it happens smoothly. And we know that we're not doing, the best job possible. So together with IDFA, I'm running a study essentially looking at people's current perspectives on transition. So I hope once the invitations go out, you'll all be interested or consider participating, and we'll be interviewing patients and their carers who are transitioning or have gone through that transition process, and their treating clinicians as well, just to have a look at some of those, things that are working well and things that aren't working well, to see how we can improve that service. And so it'll be a series of physical interviews as well as some surveys as well. Okay, I think that's my last slide. Is that Estella?
Yep, that's it.
Okay.
Thank you, Alyssa.
That's okay.
Thank you so much. Despite your cold, you pulled through.
Yeah, I'm glad I still have a voice and didn't cough too much.
So just a real thank you to Alyssa for sharing, I guess, the young person's transition journey from the perspective of a member of the adult care team. So I guess Alyssa provided an overview of what your paediatric immunologist would be thinking about and some of the things that they can support you with transitioning, and certainly some questions you could ask of them in your appointments to get them thinking about transition if that's not happened already. But particularly was very useful hearing about the barriers and supportive strategies that young people themselves raised. So I hope there was some really good tips that the young peoples in the studies shared for you. Our next speaker is Zoe Potter, a young adult member at IDFA. So we're so pleased to have Zoe present with us, I guess, sharing the young person's perspective to complement the doctor's perspective, which Alyssa has shared. So Zoe lives in central Victoria, and she was diagnosed with CVID at 4 years of age after experiencing recurrent infections. Following early treatment and physio, she was able to continue school, play sport, and enjoy friendships more. And as a young adult member, she navigated her transition to the adult healthcare system and went on to complete her training as a registered nurse and was able to travel overseas and have her baby boy. So as a young adult member, she's actually learnt to become her own advocate and hopes to help others by sharing her journey and some tips that she's found helpful. So over to you, Joey, and thank you so much for joining us.
Hello, thank you. I don't know if
We can hear you. Hi, Zoe, are you there?
I live in Central Vic, so my closest treating hospitals are the Royal Children's and the Royal Melbourne. So that's about 2.5 hours from my home. So I'll talk a little bit on the barriers from a rural perspective as well. Like you said, Estelle, I was diagnosed at 4, and I've been on a mixture of IV, IG, and SCIG programs along the way. I started to transition from the pediatric into the adult care system from about 16 years old. The Royal Children's had a really good, or still have a really good transition program that they use, and they start implementing from quite a young age. So we're prepared once we hit the adult system, or they try and prepare us as much as we can. I was given support during appointments, where towards the end of my appointments at the Children's, I had some of the team from the Royal Melbourne come over to join in on those appointments. So I got to meet my new team, which was really important in kind of helping breaking down those barriers, and I didn't feel so scared in the next step. And then I transitioned at the end of year 12 after exams. So what was mentioned before, that it's completely fluid. I turned 18 at the end of year 12, so it was only natural just to do it once exams had finished, and that had kind of that time in my life, and that stressful time had ended. And then more recently, I've managed to manage my own illness through pregnancy and postpartum, closely with the team at the Royal Melbourne, my GP, and the hospital that was involved with that. So everything that I learned during transition was something that I've taken forward at every step in my life, and it's definitely empowered me to be my own advocate. If you want to go on to the next slide. So pediatric to adult cares, what's changed? So I had to become very independent, which was a positive and a negative thing. It meant no more mum and dad at the appointments, which was a little bit hard and scary, especially for the first few ones, but it didn't take long for me to get the hang of how it all was going to run. When I moved from the pediatric system, I was having appointments every 3 months, so they were quick. I knew I had 4 appointments a year. I was well managed by the Children's, but then once you hit adult section, your appointments are 6 months to maybe even 12 monthly, depending on how well it's being managed. Obviously, they'll push back to 3 months if they think that you need it, but it is a long time in between seeing them. So that can be where that self-advocacy really comes into play. They are run different from the children. So there are a few situations where I've had to, reschedule appointments because I've had something else on that day. But I've had no other choice than just to accept whichever appointment which is available. And sometimes that can be in 6 months' time. And that's just the luck of the draw sometimes. That obviously if it was needed to be done sooner, you could try and arrange that with your GP, but it is harder to make appointments, I found. The other thing I noticed was that there are a team of doctors that look after you rather than you have a very small, intimate, maybe 1 or 2 that would look after you in the children's. So then in the move to the Royal Melbourne, it's a new doctor every time. They're all specialists, they're all brilliant, but it is a new doctor, which can become a bit inconsistent at times. And when I had my first appointment at the Royal Melbourne, I did take Dad along, even though I was fully independent, knew what I had to do. I did take Dad. Just the new environment, new hospital, parking, appointments, clinics, all of that thing. It was handy just to have someone to lean on. I did the appointment by myself, but I knew that he was there in the waiting room if I needed him. In terms of SCIG treatments, it's meant that I really have to keep on top of my own stock and my own medications. I've been very independent with doing my SCIG treatments from a very young age. So it was just kind of like another thing that ended up coming naturally, but I really have to be on top of it, given that I'm 2.5 hours away from my specialist centre. So, postage and time for scripts to get filled, that can sometimes be an issue. And things that made it easier. So having a really supportive team from the children's helped immensely. They were able to facilitate the move, make it feel natural, seamless, made me feel really confident in that. Again, like I said, with the joint appointments, that was like the most amazing thing. It really helped me set me up for, not to fail, to succeed. And also family and having a good support network that you can rely on is necessary, whether it's parents, grandparents, friends, through IDFA, having someone to lean on just to help get that independence is really, really important. And it's never too early to play a part in your own healthcare. I've been, involved in my healthcare from a very early age, whether it's, not to the full extent of making appointments or going to appointments by myself, but I've always had an understanding of my condition, what my levels should be. And I think that's, the more questions you ask, the better. It's really important. Common issues that I've found. It was nearly 10 years ago that I transitioned, so the memory might be a bit rusty on these ones, but initially a lot of the questions the doctors still directed at Mum and Dad if they were in the appointment with me. So Mum and Dad had to get really good at not answering for me and looking at me, or I would be the one that would sit directly in front of the doctor, or once we got the hang of it, they would just leave the room for half of the appointment entirely, just so it was just me and the doctor talking one-on-one. And I really got to answer the questions for myself. Again, not having to rely on Mum and Dad to make the appointments, to organise my SCIG treatments, to organise my IVIG appointments. That was a little bit hard at the start. And I guess the other thing is to fit it in with school and hobbies and work. It was a bit draining. It still is a bit draining to just have another thing to add to your list, day to day. We don't ask for this. It's but it is going to be a part of our lives. So allow yourself to go, this is, not ideal. I don't like this. I wish I didn't have to do this, but, allow yourself to be in that for a moment and then go, all right, on to the next thing. What do I have to do? And obviously the stress. But I've found some little ways to help reduce the stress, which I'll go on to in a little bit, just with some tips. And what do I wish that I knew back then? So I wish I knew the importance of self-advocacy. I'm a passionate, person for advocacy in young adults. I think you've got to be your biggest advocator. Our parents have done it, or had done it, for a very long part of our lives. They were the ones that pushed for diagnosis. They were the ones that, went to appointment after appointment to try and work out, what was wrong and to make sure we were being treated right. So now it's up to us to take on some of their leadership and follow their footsteps. And we do know our conditions and our bodies best. So back yourselves. You're the ones that live it. You're the ones that have lived it. So, own your illness. The move from the adult system the move into the adult system, again, it's important to voice any concerns, ask lots of questions. You don't have to know everything all the time, and no question is a silly one. All right, on to the next slide. Tips and strategies. So these are kind of my little tips and tricks to get you through young adulthood and transition from pediatrics into adult care. So a health journal or a book or a notes app now. So back when I was transitioning, it was a book, but some people might find a notes app works better for them. So have just one big dedicated section that you can write everything from symptoms to when you're getting sick to appointments that are coming up, questions to ask in your next appointment, anything that pops up, just write it down when you think of it. Because like was said previous, you only have maybe 15 minutes with your specialist. So it's really important to get the most out of those appointments. And going in with a plan. I was and still am a bit of an anxious person. So I would sometimes rehearse what I was going to say to the doctor, how I was going to say it. So before I went in, I had a bit of confidence and I, had a plan of attack. Keep track of scripts. So I'm a bit of a shocker with having scripts all around my house, and you can use things like a Priceline script app or whichever pharmacy you use. Most of them have an online script app now, where you can put your scripts in, when they're going to expire, say for myself, I need to have some backup scripts around the house for when an infection hits, so I can jump on a quick course of antis without getting in to see a doctor. So if I have them there, and I know that they're within date, then it's a quick way to, keep track of them all. And at your next appointment, say, oh, I'm running out of these ones. Can I please get them filled? Thirdly, so ask the doctors what they want from you. Ask them what information they require. Initially, they'll need your history, your social history, medical history, but ongoing from that, what do they want to know? When do they want to know how often you're getting sick? Do they want to know how well your treatments are working? About your mental health? Ask them all the info they need from you, and you can try and get that together before your next appointment. That goes for GPs as well. And then get mum and dad to explain what they've usually done for you in the past that I found in terms of making appointments or the little admin-y things that went on behind the scenes. Every time they went to do something, I'd ask mum and dad to explain it to me, or how do you make an appointment, or who do I call if I get really sick, or what's the best contact number for my specialist, that type of thing. And get that started from an early age. So then when it comes time that you've transitioned, it's just second nature. You know what to do already. Find a good GP. I'm quite lucky. I've still got a GP that I've had since I was younger that's in my hometown. The clinic there know that when I call up, it's, I need an appointment quite soon, so they're able to slot me in or find one that's got available, appointments that are available readily, just so you've got another person on your side of the bench. And self-care, it's so important to do something for you, to find time for you. It's a big responsibility to have on your shoulders at such a young age that most other people our age wouldn't have to think about until, they're 30, 40, 50, that people don't even need to see doctors unless they're, acutely unwell. So take your time to socialize or relax or find days for you, keep your rest up, get your sleep. It also comes at a time where there's bigger changes happening in life. So whether that's starting university, moving out of home, starting a full-time job, there's a lot going on in your kind of 18 to 20-year-old period, even further. So there's a lot of change. So you really need to take time for yourself and your health. Find a good support network, really tack into that. And if you're feeling anxious at any step of the way, contact mum and dad, contact your support system and say, hey, I'm really struggling with this. What would you do in this situation? Or can you just take over this for me for a month? Or can we put that on the back burner for a little while? So they're the things that really helped me, and I still use them. They're set in stone now. They're the stuff that I do just to manage a chronic illness, really. All right, next slide, please. Thank you. So I thought I'd touch a little bit on transitioning from IVIG to SCIG. It's a massive transition in itself that sometimes can be happening around this same age. So I've swapped and changed between the two my entire life. I've gone back and forth, yo-yoed, but that's the beauty of it. We're so lucky that we have two awesome programs that we can use. I mean, within reason, depending on levels and health and that type of thing. But it's really quite good to know what to expect with both. So, firstly, my transfusion story, I guess you could call it. So originally, when I was a child, I was IVIG. That was the only thing that was available. It was just it was the best thing that we could have done. And then once I hit about halfway through primary school, I would say, the Children's offered us the ability to go on a trial for a SCIG program, I was one of the first at the Children's to take part in. And it was so amazing. It got me back into school, because at that point I was missing a month to go to school. And this meant that I could do it all from home, tailor it to my needs, and it was really, really wonderful. Then when I hit VCE kind of age, I felt that IVIG was probably better suited to me at that point. I had a lot of extracurricular activities, exams, that type of thing. So I couldn't keep regular with my SCIG, and I was getting infections. So we went back onto IVIG, but again, that was a decision that I made myself, and I was empowered, and I was able to advocate, for myself. And that was one of the biggest things I did at one of my last appointments with the Children's, was for me to step up and say, I know SCIG is better, but right now IVIG is what I need to do for me. And then I've flipped back onto SCIG when I was at university. It was the better option. Again, my veins have started to fail on me a little bit, and I couldn't take full days off anymore. So then when I fell pregnant nearly 2 years ago with my son, I then had to go back onto IVIG just so my levels could be better maintained. The SCIG is amazing at keeping your levels higher for longer, but I was finding it a bit hard to find a site to do it, and then the growth, the weight they put on with having a child made the levels harder to maintain. And now post having my son, I'm back on SCIG. I do need a lot of reminders, a lot of calendar reminders and little alarms on my phone, so I know I'm doing it every week because life gets a bit busy, but it's meaning that I can just do it with a cup of tea, take some me time, read a book overnight once he's in bed. So tips from going from IVIG to SCIG. So initially there were a lot of blood tests to make sure that I was on the right dose for my weight. It didn't take very long at all. It's all weight based, but there are a few blood tests to start with. The second is to keep it to a strict schedule. So the same day every week, try your hardest not to stop, because just one day a week can completely make you start to dip in your levels. The other is to keep track of stock, so a really important stock take system, and same with your medication. I have had some times where I've lapsed a bit and thought I had an extra week and I didn't, so I've ended up having to push out my SCIG a few more days while I've waited for the postie to come with my new stuff. But I have a SCIG nurse that is on top of all of that at the Melbourne, and I just email her, and by the next day it's in the post. Is amazing. What else have I got here? And numbing cream. Oh my goodness, I cannot recommend it enough. To mentally prepare yourself to do the needles. I've been doing it since I was maybe 9, maybe 8 or 9, and I still every week hate doing it. So get yourself some good numbing cream, and it'll definitely help. And then tips, just if you're going from SCIG over to IV, there will be some blood tests involved, but that's nothing that can't happen when they put the cannula in if your team have the slip for it. Good communication with your doctor. I communicate better with my GP. It's quite easier to do that. So find a doctor that you can communicate with better. If that's your specialist, then that's amazing. There will be a natural drop in your levels around the 3 to 4 week mark. So be prepared for that, but it should pick up again nicely once you get it routine. And then obviously keep hydrated, make sure your veins are nice and plump before you go in to have a few attempts of the cannulation process, which can take a little bit of time. So that's my little story on the changing. And I guess I just wanted to end on being your own advocate. No one knows your body like you do. You've got to, be your own voice. It is hard at the start, it really is, but once you start owning your own health, it'll become so easy and so naturally, and make the process much nicer. Thank you.
Thank you, Zoe. Thank you so much for taking the time, I guess, to really dive deep into some of the lived experience. And I know everyone hears a lot of this stuff, perhaps from their doctor or perhaps from their other health professionals, but there's nothing like hearing it from someone who's been there, done that, because it's just so much more real. And thank you so much. There's so much in there. So I guess I encourage young people to re-listen to Zoe's story again, because there's just lots of information there. So thank you so much. So in this last section, I just really wanted to share some useful digital and other resources that you might find useful in your own mental well-being. I think as Zoe was really driving home that it's something that's just top of the mind, I guess, when you're thinking about transition, but not just that, I guess, as a young person. So I hope some of these resources can help. We're looking at the first, which is the self-advocate tools. Now, these are more related to those appointments, helping to manage the appointments, like what Alyssa was talking about. So there's a medical history form there for you to keep dates and records of symptoms. and also when you're changing different treatments or medications and what the kind of side effects are like. So you can write those down, because when they happen, guaranteed at the appointment time, it'll all be a blur to you. So it's great to take all that in when you're going to your appointment with your doctor. There's also an advocacy plan where this is more like an empty form where you can write your needs and questions. You can really sort of brainstorm outside of even just medical stuff, like even just health and well-being stuff, lifestyle stuff, just to really ask your doctor. I mean, it's the only time you'll see them in a couple of months potentially. So, you know, you can really then advocate for what's most important to you. So again, on the IDFA webpage, we do have a booklet on moving from child to adult care, but also we do have a lot of booklets that just explain CVID, primary immune deficiencies and secondary immune deficiencies. If you find you're working with a new team or perhaps some allied health professionals that you haven't worked with before that don't know much about immune deficiencies, so it kind of takes the heat off you having to explain a lot of things if you can take some of those booklets or print them off the webpage. And as Alyssa was mentioning, there's a transition checklist, which is really a one-stop shop for questions. Get your brain working on, I guess, all those different areas that Alyssa was talking about, and also Zoe touched on, because there might be some things that you're doing already, but there could be some things that, you know, would really make a big difference for you in the next year or so if you get them done now. There's also some digital mental health resources, and this is a great little brochure that we found from MPRAC, and it's really a service for mental health practitioners, but this is a particular brochure where young people can self-direct to use particular mental health and wellbeing resources that are endorsed, and just explore, I guess, in terms of what you want and what you need. So they cover lots of different things like anxiety, depression, stress management, even broader things like just not feeling great about your body image, and even things like, you know, perhaps if you are using substances, there's just such a broad range of digital resources out there that are great. They're anonymous, and you can interact with other young people if you choose, or not. You can just do things at your own self-pace. So you can pick out something that's a good fit for you. And if your transition is particularly stressful, or you're experiencing other things that really do make it difficult to cope, there is free support available, and it's anonymous as well if you want it to be. And you can reach out to places like Beyond Blue. They offer a 24/7 support person that you can call, and they even have online connection with people. Headspace, a national youth-specific service, offering online and phone and face-to-face support. Reach Out also has available anonymous chat site and resources for young people. And Kids Helpline is also an anonymous call support service for up to 25 years with lots of shared stories from young people and resources. And of course, you know, if there is a risk of immediate harm, you know, you can work with the person that you're speaking with to help. Obviously, then it wouldn't be anonymous, but, you know, you would move through what steps you can take and how you can be supported. So just visit their websites and really check out ahead of time, you know, before you actually need these services, which one would you go to? You know, what's a good fit for you? And you can also reach out, of course, to IDFA Young Adult Members Support Chat, our YAMS group, which are on Facebook, and also online chat, just to connect with other young people who are, I guess, going through the same sorts of things that you're going through. You can also obviously reach out to your healthcare team, your GP, parents, carers, and really other support people that you feel comfortable with. So it really is about you and what you feel comfortable with. What's your support network look like? And we know the transition into adult care can be challenging, on top of just the day-to-day of being a young person. So I guess the real message really is that it's okay to feel anxious and unsure. And talking about it really can help work out where you're at, so you can get support to take it step by step at your own pace. So I guess that now concludes all our presentations for this webinar. And once again, I'd like to thank Dr. Alyssa Kane and, of course, Zoe and all the young members that contributed their questions for this webinar, which was just great. And I'd also like to thank our sponsor, CSL Behring, who've supported our PI webinar program with an unconditional education grant. And just to say that CSL Behring has not determined and is not responsible for the agenda of this particular event. So I'd like to quickly launch the poll questions and ask everyone to kindly complete the survey, because your feedback is really invaluable for us to, I guess, improve our PI education program. So I'll leave the questions up for the next couple of minutes, and you're welcome to provide your feedback. So I'll just stop sharing the screen and move on to the poll. We're just waiting on one more person. Thank you for your patience. Just in the interest of time, I might actually just end the poll here, as we are beyond our time for this evening. So thanks again, everybody, for joining us, and please keep an eye out on our emails and Facebook for details of upcoming webinars. So our next webinar in September is on SCID newborn screening. We're going to be, I guess, titling it A Brave New World for Carers and Babies, and really to explore what the rollout of screening now means for the early detection of immunodeficiencies. So we're looking forward to hearing from some speakers on that. So please join us and look out for that in our newsletter and our Facebook page. So thank you everyone for joining us, and thank you to Zoe and Alyssa, particularly for our presentations. Thank you.